Welcome to Health Matters on Channels Television. Thanks for staying with us. I am Mary Alale Yusuf. The global figure for COVID-19 as at September the 25th was over 32.5 million. More than 22 million people had recovered, and there were more than 988,000 deaths. On the same day in Nigeria, 58,062 infections were recorded cumulatively, out of which 49,606 have recovered and 1,103 died. The overall recovery rate was about 85%. Mortality rate is about 1.9, remaining steady there. So far, 494,577 samples have been tested. About 80% of infections are without symptoms. That's infections of COVID-19. But when present, they include a dry cough, sore throat, breathing difficulties. Infections are more severe in older individuals and those with underlying conditions. One of these conditions is heart disease. According to the World Health Organization, cardiovascular diseases, which include heart diseases, claim 17.9 million lives every year. That's 31% of all global deaths, and that could increase in the presence of COVID-19. My guest is a consultant cardiologist at the Lagos State University Teaching Hospital. He is also the immediate past secretary of the Nigerian Medical Association, Dr. Ramon Moronkola. You are welcome to the show.
Thank you. Thank you for having me.
So since we're looking at what the connection between the heart and COVID-19, that's one of the conditions people mention as underlying. That and cancer always come up. What are the risk factors of heart disease or cardiovascular disease?
Okay. Thank you for the question. Cardiovascular disease, to start with, to put in perspective, talks about diseases affecting the heart and the blood vessels. To further put in perspective, heart, we say, is the organ that pumps blood to the body, while the vessels are like pipes that take the blood
to and away
organs.
From the heart.
Exactly. So, the risk factor for cardiovascular diseases, that means diseases affecting the heart and vessels, we call them cardiovascular disease. So, the risk factor for cardiovascular disease, for epidemiological importance, are grouped into two.
Okay.
The reason for grouping them is you don't just classify things without reasons. So, we say there are some risk factors that are non-modifiable.
Yes.
Reason meaning these are factors, risk factors that we can't do anything about.
Like age.
Exactly. The older you get, the higher chances of developing cardiovascular diseases. Like race. Some are common among blacks.
Too bad for black people, right?
Well, some are common among white too, like myocardial infarction, heart attack is common amongst them. So stroke tends to be common among blacks. So race plays a role there. Genetics, hereditary. If your parents have some of these cardiovascular diseases, like your parents are hypertensive, they are diabetic, there's a high chance of you getting developing cardiovascular disease. So those are part of the non-modifiable risk factors. It means there's nothing we can do about them. But the good thing is that there are modifiable risk factors, the ones we can do something about. Example, hypertension. You can do something about hypertension. That means if you
can control it.
Exactly. Avoid smoking. That means stop smoking. You can do something about that. Avoid excess alcohol intake. If you're obese, lose weight. If you're not obese, ensure you don't get obese. Reduce salt intake. Try and be active. Ensure you engage in regular exercises. Diet, very, very important. If you watch your salt intake, it helps to either prevent you from developing cardiovascular disease, or if you have, it can also help to lower your blood pressure. Taking enough fruits and vegetables. These are things that contain potassium that is good, that also helps to reduce blood pressure. Avoiding food that is high in what we call saturated fats. Because the combination of hypertension, diabetes, obesity, and high cholesterol, they are the three major leading
But that didn't sound like a triad. That sounded like four things.
Yeah, it's a combination.
Okay. Diabetes.
Hypertension.
High blood pressure.
Obesity. High cholesterol level.
Oh, cholesterol. That was the fourth one.
Yeah.
Okay.
So, you see the importance of classifying into non-modifiable and modifiable. Now. So it means there's hope if you stick to healthy lifestyle by watching all this. It reduces your risk of developing cardiovascular disease. But let me put a caveat there. The fact that you engage in healthy lifestyle doesn't mean you won't develop cardiovascular disease.
Okay.
A typical example is driving on a highway. If you observe all the rules, caution, the risk of having a fatal accident is very low.
Minimal.
Minimal, isn't it? Compared to an individual that is driving blindfolded, the risk is higher. So that's like the way to look at it.
Oh, but that's a good risk.
Yeah.
The risk is much lower with your eyes open. Okay, so when you say heart disease, people center it to one thing usually, and that's a heart attack. What are different manifestations, let me put it that way, of heart disease? What kinds of heart diseases do we have? If you could just give us 3 or 4 examples.
Okay, so specifically talking about the heart failure, people can develop rhythm problem in the heart. That's when people rhythm problem in the heart. That means
heart beating too fast or too slow.
Or too slowly, or beating irregularly.
Okay.
You understand? So, but to expand it, instead of talking about the heart itself, I mentioned cardiovascular.
You have to go to the vessels too.
Exactly. Stroke is a very important cardiovascular disease. In fact, it's one of the leading causes of death attributable to cardiovascular disease. If you go to emergency, randomly,
that's the black one, the black man's own stroke.
Yeah. So if you visit an emergency unit of most of our general hospitals, spending 4 or 5 hours is too much for you to discover 1 or 2 stroke patients being admitted. So
that's
stroke
common.
is very common. Stroke is a very important cardiovascular disease. We also have, since I mentioned vessels, I say heart and the vessels. So we also have, see some individuals complain that after walking a short distance, they develop pains in their calf. They have to sit for a while to rest before the pain reduces. We call it intermittent claudication. It's also part of cardiovascular disease. It can be so severe in some that it can cause gangrene.
And one would think that because it's down there in the ankles, it has nothing to do with the heart.
Exactly.
But we'll come to symptoms.
Okay.
We are there already. What if somebody is having, let's say, a stroke or a heart attack? What do you see? What does the person feel? Because they've got to know when it's dangerous, when to come to the hospital. So what are the signs that they should start running to the hospital?
Okay, before I go to that, let's agree that the best is for
them not to get to that
develop
place.
that. Exactly.
Yeah.
So our aim, our target, our emphasis is on prevention.
That's right.
You understand? Preventing development of such conditions because it's the mortality seems to be high. Okay, fine. Talking about heart attack, one of the symptoms we don't joke with at all is chest pain. So I don't even want to characterize the chest pain. If you have a chest pain, seek your doctor's advice.
It doesn't matter what kind of chest pain, what side.
No, I don't want to start oversimplifying it.
Because people will begin to say,
so
that's
say,
not
okay,
the
I
chest
think
pain the
my
doctor
own chest pain is not the type that the doctor was describing. No, if you have a chest pain, exactly. If you have a chest pain, it's what consulting your doctor. It's very important. Well, stroke. People develop, what we know most about feature signs of stroke is people develop weakness of usually one side of the body, the mouth gets deviated to one side. That's what we see.
But that's a bad time to be going to the hospital. You should have gone long before that. The doctor can see signs of that, right? Before you get to it.
In some individuals, they can develop what we call transient ischemic attack. That means they have like warning sign.
Baby stroke.
They have baby stroke.
That's what I like to call it.
So you have something that like a stroke that's resolved, something like that.
Okay.
So like I said, those individuals are lucky. If you develop that and you visit the hospital, it gives the doctor opportunity to intervene, to tell you that there's danger, we need to intensify on our prevention.
Okay, but you speak as if some people skip that to the more serious one.
Yeah. Some people may not develop the warning signs. Some may not have a TIA, what we call transient ischemic attack. They just have frank stroke.
Okay, we're talking about this because with the advent of COVID-19, especially in the beginning, lots of people didn't want to even go near the hospital. They would sit at home and say, no, I'm going to sit this one out. I'm going to ride this one out. I can't go to the hospital. Maybe they will give me COVID-19 there. Tell us, is it better for people to just stay at home, take some medication, ride it out, and avoid COVID-19, or go to the hospital?
Maybe that question is...
I need people to hear this.
Well, the answer to the question is a mixture of many things. We tell people to avoid going to the hospital unnecessarily.
Okay.
If you don't have serious reason to go to the hospital, let's start from...
But you know, some people, they really feel bad. But halfway to the hospital, they're like, I'm not sure, the doctor may laugh at me. It's not really that serious. I'm telling you, this is what people say.
I'm getting at that. So the reality is that we tell people to avoid visiting the hospital unnecessarily. A typical example is hospital visitation.
Okay.
You are going to visit the sick in the hospital. Not this time. This is not worth it. Now, if you have reason to visit the hospital, you have to go to the hospital. Now, the reason I said is a mixture of many things is that the burden shouldn't be that of the patient alone. The healthcare providers, the government, must also try to provide a solution. A typical example is telemedicine. Many of our hospitals are giving the option of telemedicine. Okay, can you, instead of coming around for your appointment, can we do a phone conversation? We can do virtual conversation.
Would you do a phone conversation with a heart patient?
Yeah, you can. Not in an emergency situation.
Okay.
I mentioned. So if you have chest pain, for example, and we're able to, it's a consultation. We have to adapt our system to the prevailing circumstance, isn't it? So if you have to come in, let's say, for example, this is hypertensive patient. He comes in every month for his clinic, and we are saying, instead of you coming in, can we do a phone conversation or virtual consultation?
But it could get to a point where you say, this can't continue
Exactly.
over the phone. I need to see you.
So during the course of the phone consultation or a virtual consultation, if I get some signs, you give some complaints that seem like something serious is ongoing down there, we have to tell you to come to the hospital. So what we are saying is we need to develop our system to accommodate some of these concerns.
Okay.
So the burden shouldn't be that of the patient alone. We shouldn't leave the patient to keep thinking, should I go to the hospital? Should I not? Should I stay at home? We should also develop a system that will accommodate those fears. So the patient can book appointments and do a virtual consultation, during which the doctor can assess how serious his condition is before and advise appropriately.
Is there provision for you to, after having seen a heart patient, give the person enough medication for a sustained period of time so that the person doesn't visit too often?
We do that. It's part of a response to the prevailing situation. Reduce frequency of hospital visit. So if a patient that is hypertensive, for example, has good blood pressure control, you want to...
And can even take his own blood pressure. You do that these days. Yes.
That is a key part of management of...
But we have to go on break. When we come back, we'll continue that. Please stay with us. We're going on a short break. Matters, and we are talking COVID-19 and the heart. Incidentally, the World Heart Day is on September the 29th, and there will be campaigns all over the country, and we are starting ours from here. The number to call is 0808 054 2233. You'll see that on your screen if you have questions about the heart and COVID-19. And you can also tweet at CTV_Mary A. We're going immediately to the connection between COVID-19 and the heart. Now, if somebody has a heart disease or a heart condition, we understand that COVID-19 could be more severe. What could it look like?
Okay. The relationship between COVID-19 and the heart is like a vicious cycle setup. Even in individuals without heart, cardiovascular disease, without heart condition, COVID-19 can cause some of these heart diseases in them. COVID-19 can cause myocardial infarction. It can make the heart fail.
Fail?
Exactly. By infecting the heart muscles directly,
okay,
the heart muscles get weak, can become bigger. And when I say heart failure, I'm not saying the heart has stopped working.
Okay.
It means the heart is not, when people fail in exam, it's not like they didn't score any, they have a score at all. Just that they are below the pass mark. The heart is performing below pass. Because at that state, the heart is not able to sustain enough blood. You know, the function of your heart is to pump. It's not able to sustain enough blood to the tissues.
But you're talking about a heart that didn't have any problems before COVID-19.
Exactly, that can happen. I'm saying the virus itself can infect the heart.
Let's quickly take this phone call. Hello.
Hello,
Haruna.
Good morning, ma.
Good morning, Haruna. What's your question?
Good morning, doctor. Thank you very much for the very educative and all-important topic on health matter.
Morning, Haruna.
Please, I want to ask the doctor, you have spoken extensively about some few issues relating to heart disease. But please, can the doctor kindly narrow it or corner it to area of lifestyle that one needs to a kind of adopt for a healthy heart?
Thank you, Haruna.
So
he touched on that earlier, but I'm going to let him run through it again. How do you maintain a healthy heart?
Okay, so maintaining a healthy heart, I like to approach in two directions, from 2 points of view. First is from individual point of view. So we say primary prevention. Preventing the development of cardiovascular disease is not there. We don't want it to come.
Yeah.
So if you come to the hospital and I give you a clean bill of health,
yes,
it doesn't mean all is well, because it doesn't mean means you can engage in excessive alcohol consumption, engage in smoking, eating unhealthy diet. It means I'm saying there is no problem now. A problem can still come. So you must still maintain your healthy lifestyle. If you don't smoke, don't start smoking. If you don't consume excess alcohol, don't start consuming excess alcohol.
It's a loaded gun. Don't shoot it.
Exactly. So that is an individual level. So also, we encourage people to go for regular checkup. Hypertension is one of the leading causes of cardiovascular disease.
And that's something that the doctors check every time you get to the hospital.
Yeah.
At least I know that.
Exactly. So, if you don't wait until you have symptoms before you check your blood pressure, you understand what I'm saying? So, regular checkup is very important. That is when you will notice that my blood pressure is beginning to go up, and they advise you appropriately. You don't wait until your blood pressure has been doing 170, 160 for a very long time before it is discovered. The same thing with blood sugar.
Wouldn't some damage have happened if that is regular?
Exactly. In fact, what we talk about now is a cardiovascular continuum. It means even before the blood pressure gets above the mark, something's already going on. More like the tip of the iceberg you are seeing above the ocean. You understand? So some issues may have been going on, pushing the blood pressure up gradually from 115 to 120, like that. The reality is that studies have shown that For every 20 millimeter of mercury rise in blood pressure, from 115 millimeter of mercury, for every 20 millimeter of mercury rise, the risk of developing this cardiovascular disease doubles. So, we are saying generally we do 140.
So check it and then keep it down.
Exactly.
By less salt.
Exactly.
Less saturated fats.
So that is talking about an individual. Now, even at a community level, so, I said we shouldn't leave everything to the patient. Community level and institution level, there must also be intervention.
Let's quickly take this other phone call. Hello? Something is wrong with the line. Would you try again? Thank you. Any other prevention?
So, we say check regularly. I mentioned some of the prevention ways of preventing or even reduce the risk for those that develop hypertension, for example. Salt intake, avoid consuming excess saturated fat, that's developing high cholesterol level, being active, do regular exercise.
Being active is be active, not avoid being active.
Being active.
So do your exercise.
Do exercise regularly. So those are the things you need to do for prevention.
And keep your weight down.
Exactly.
I got that.
So community intervention too is important. So we must support each other. There must be an intentional move by the community to rid themselves of cardiovascular disease. It is being done in some communities all over the world.
What exactly do they do? Do they call everybody out for exercise or what? Exactly. Or fortify food or? So,
what of forming fitness club in your community?
Okay.
When we have anything to celebrate together in our environment, what of ensuring that what we have on the table is relatively healthy?
Okay.
For those that develop cardiovascular disease, we must understand their limitation and encourage them. We must set up an environment that is encouraging for them. What of advising members of the community to stop smoking? Don't create smoking areas in your community. Well, even if you are forced to.
Okay, I'd like to come in there because I really want to ask about the people who develop heart problems from COVID-19, who didn't have heart problems before. Do some of these things get resolved by themselves?
Well, some get resolved, but the reality is that if the heart has developed a problem, the heart must be monitored for a long time.
Okay.
What we have to contend with is that COVID is relatively new. So what is going to happen in nearest future, we may not know. We don't know the cost some of these things will take. But the reality is that someone has developed a large baggy heart from effect of COVID, well, there may be some improvement over time, while some may not improve. But it's still a matter of time for us to really know the true picture of what the COVID
So
is.
the final advice would be, don't develop a heart problem and don't get COVID.
Exactly. Just like you said about the World Heart Day. The theme is using the heart to fight cardiovascular diseases.
All right. We've got to close.
Oh, thank you.
I had to stop you there. Thank you so much for coming to the show. It's been so enjoyable. Thank you for being with us and for all your calls. Please, try not to get COVID-19. Wear your mask, keep your social distance, don't go to crowded places, and live a healthy lifestyle. Enjoy your day. I'm Mary Alale Yusuf.